அனைவருக்கும் வணக்கம். I am Sherlin, Standard 7, studying Lghsc Girls Higher Secondary School. I am also a student of Junior IAS Academy.
இன்னைக்கு நம்ம ஹியூமன் anatomy லெசனில் supine anatomy-னா என்னன்னு டீட்டெயிலாக பார்க்கலாம். Welcome friends, pleasure morning to all. Today we are going to discuss about human anatomy. What's the topic? Human anatomy, part 5. So, only if you know you have a thorough knowledge where you are supposed to put your strength to hear the apex beat, and that is called as clinical anatomy. You all the procedures, that is appendages, whether it is test anatomy and so on for everything. When you apply your anatomy in a clinical setting, that is clinical anatomy or applied anatomy. Now, of course, dealing with the medical sciences and the basic of medical sciences, anatomy, physiology and biochemistry. So, these three subjects are actually as the preclinical subjects, and they are also called as the basic medical sciences. So, every art or for that matter science has its own language. Save medicine also has a language. Why it has a language is because only if this language followed universally, it should be accepted. So, anywhere you go, if you speak this language, then what happens? People who are in this profession will definitely understand. So, for that, to understand the language of medicine, what we call it as normal literature. In anatomy, this language called as anatomical normal literature. So, in the forthcoming slides, I would be speaking about this basics of this anatomical normal literature. So, please pay attention for you. First and foremost, if any structures has to be described any textbook or any research material or any way you come across what is referred as called as normal anatomical position. So, all the structures described anywhere in the world, if you read anything about anatomy, is assumed that particular nerve or muscle bone is described assuming in this anatomical position. What is actually an anatomical position? A person standing erect, upright with the head, gaze, toes facing to the front, arms hanging by the side with the palms facing front, lower limbs close to each other, and what happens? Feet parallel and toes directed towards front. I will repeat. A normal anatomical position is a person standing upright, head, gaze and toes facing front or looking forward, arms hanging by the side with the palms facing front, lower limbs close together and both feet parallel and towards toes directed towards front. This is normal anatomical position. Sometimes some books also refer to and other position which is called as supine position. Certain structures are actually described with keeping this position in mind, that is supine position is the position where lying with the face directed upwards and your back resting on to the surface. This is actually called as the supine position. The opposite of supine position, what you see here, is the prone position. இன்னைக்கு நம்ம ஹியூமன் anatomy லெசனில் supine anatomy-னா என்னன்னு டீட்டெயிலாக பார்த்தோம். மீதியை நம்ம நெக்ஸ்ட் வீடியோவில் பார்க்கலாம்.